signs.
Would you agree with me that all of these problems, I call them problems, signs, symptoms, whatever you want to call them,
Yes, sir.
all of these can be consistent with Cauda-Equina syndrome?
They can be consistent, yes, sir.
All right. Did you consider it at all?
I did.
Did you rule it out?
I didn't rule it out, but I didn't, it was still on my list.
How were you going to go about ruling it out?
Time.
How long?
Watching.
Well, time's of the essence in Cauda-Equina, isn't it, sir?
Yes, sir.
Okay. Did you notify Dr. Miracle about these findings so he could assist you in this differential diagnosis?
Did not.
And why not?
Because I felt I had a stable patient.
You would agree with me as a nurse practitioner, you had a duty to rule out Cauda-Equina at this time when you got this report from Nurse Hebda, didn't you?
I had considered that Cauda-Equina was an option, and I based it on the fact that he had strong proximal legs, normal groin sensation, difficulty voiding with a bloody catheter, sock-like numbness and weakness.
Okay. Let me be specific with you here. You know what the standard of care is that applies to a nurse practitioner such as yourself for this period of time when you're providing care to Mr. Link.
Yes, sir.
Did the standard of care require you to consider Cauda-Equina syndrome based on these symptoms?
I did consider Cauda-Equina syndrome.
Okay. Did the standard of care require you to rule them out?
I did rule it out.
Okay. I thought you said that you were waiting to rule it out.
I was saying that I was watching for more symptoms of Cauda-Equina to determine if it was potential. But this time it was not something that was high on my list of differentials.
Cauda-Equina is a potentially devastating condition, isn't it, sir?
It is.
It can lead to someone being paralyzed, can't it?
And has.
How long were you going to allow this process to go in order to rule it out?
I was treating the symptoms that I thought needed treating. I was giving him steroids to get rid of some of the inflammation. I was looking at potential causes for irritation, screw malposition, stuff like that. I was thinking that part of his problem was that we needed to get him up more. He was not well motivated to even roll over, much less to get out of bed. I had trouble getting push-pulls out of him sometimes just because he didn't want to do them. So,
would you agree with me that these findings that were made and related to you on August the 20th were substantially different from the findings that were made on August the 18th and August the 19th?
They are different.
This was a major change in the patient's condition, wasn't it?
Not substantial.
Well, what's the difference?
Well, I'm trying to see what you say is substantial.
I mean, he can't use his ankles.
Mm-hmm.
I mean, he can't stand up.
Can't stand up.
I mean, he's got numbness.
Mm-hmm.
I mean, he's got tingling.
Mm-hmm.
I mean, he's got weakness.
Mm-hmm. He's got pain when he puts any pressure on his feet.
He's got urinary retention.
Wait, let
me just finish. Let me just finish my quick, because I want you to have the benefit of all these things.
Gotcha.
So a neurosurgeon who's going to look at this case can make a judgment.
Yes, sir.
All of these things are happening now since August 18th and 19th. And my question is, would you agree that is a major change in the patient's condition?
I agree that it's a change. I would not call it a major change.
All right.